Good morning, and thank you very much for joining us today, Bob. The UNODC Opioid Strategy, as we know, is a 5-pillar integrated response to the opioid crisis. And with the current COVID-19 global pandemic, we find ourselves dealing with a dual public health crisis. Today, I'm glad to be joined by Bob van den Berg, who is the law enforcement expert working with the UNODC WCO Container Control Program. Bob, thank you so much for joining us today.
No, thank you very much, Asma, for this. And first of all, allow me also to say first, on behalf of the Container Control Program, that we hope that this message, in fact, finds you and your family healthy and well, because we have been thinking about you all and hoping that you are weathering the COVID crisis as well as one could hope. But anyway, so the Container Control Program, the CCP, has now established around 119 units in 59 countries, with many more units anticipated to come online in the next few months alone. But the program is also reacting to the COVID-19 crisis in a considered and systematic way. And we are, of course, using our resources as fully and best as possible to maintain the continued business and still safeguard communities from illicit trade of opiates over this crisis. We currently see a decline in seizures, along with a large decline in the overall traffic, but it's clear that the current demand of protection equipment and products in treating COVID-19 exceeds supply, providing in fact a perfect market for medical counterfeiters. And in this sense, our program will continue its activities, refocusing efforts on maritime ports, airports, land borders, and also train cargo crossing border points that are most vital to COVID-19 and opioids efforts.
Thank you very much, Bob. And we are so glad that the Container Control Program is one of the key collaborating partners of the UNODC-led, global response to the opioid crisis, also known as the UNODC Opioid Strategy. And what you've mentioned really very perfectly paints the picture of how the COVID-19 pandemic has really affected and influenced border control efforts to disrupt the trafficking of synthetic drugs, and more specifically synthetic opioids. And I wanted to get a sense from you also a little bit as to how does the Container Control Program respond to this complex situation where we are looking to secure the freight trade in the midst of a global health pandemic and with all the restrictions that we have, of course, with physical distancing?
Well, first of all, the COVID-19, clearly it's causing many disruptions to the drug supply, and that's where the Container Control Program, in fact, is trying to anticipate how those disruptions will evolve over time. Just as COVID-19, in fact, affects the legitimate business, also organized crime is affected by this, and they rely on global supply chains to produce, transport, and sell illicit goods. So they also need to restore their business model, in fact. And our Container Control Program implementing partner, the World Customs Organization, they have initiated a new group to collect, collate, and disseminate information and intelligence on opioids, chemical substances, fake medical products, and also other material in the context of this COVID-19 situation. The group, in fact, distributes any relevant information for targeting purposes to the CCP staff in the field and towards the container control port units. The distribution of these counterfeited goods, they have been widely reported by law enforcement and by the media. And in this context, in fact, the COVID-19 pandemic counterfeiters particularly have focused on goods used in the fight against the pandemic, including medical equipment, sanitizers, pharmaceuticals. And therefore, CCP, of course, will continue to strengthen border control capacity to detect and stop opioids and clearly also other illicit illegal shipments.
Wonderful. Thank you so much, Bob. And it's great to hear of this initiative by your implementing partner, WCO, and by the Container Control Program as well. And we're lucky to have the beneficiaries of the UNODC Opioid Strategy also able to benefit from this knowledge and this intelligence in a way that is gathered through this effort. I'll ask you one last question. Of course, UNODC and the Opioid Strategy, we serve member states, and so In this sense, how can we support member states in strengthening their drug control responses, looking specifically at trafficking of synthetic opioids and synthetic drugs during this challenging time of the global pandemic? And how can they benefit from the UNODC WCO container control program?
Thank you so much for your question, Asma. But the container control program, we want to reassure that donors and key stakeholders, in fact, that we are reacting to the COVID-19 crisis in a considered and a systematic way, and that we need to pivot in new directions. We need to be shifting to distance learning opportunities so as not to lose clearly the momentum in our key program. And in this sense, we are trying to establish online style of training and activities in order to keep in contact and work with our unit officials. We are planning, and we are also in the process clearly to deliver a blended approach, in fact, meaning a combination of e-learning, online training, and remote mentoring. We also have established an informal working group with the United Nations Office on Drugs and Crime and the World Customs Organization staff to look at the different options we could use related to the detection and the interception of counterfeits, substandard goods, and intellectual property crime in the COVID-19 pandemic. Counterfeit goods sold during the corona crisis do not meet the required quality standards, and they really pose a real threat to public health and security. And the CCP therefore continues to focus on the main countries of production that have remained clearly the same. And this also applies, of course, clearly for modus operandi and for the routes. But anyway, we don't see this as something that can substitute the normal training curriculum, but we are so convinced that our units will be able to operate in this flexible style way. And again, we are looking forward to seeing you all at the other side of the crisis.
Thank you so much, Bob. We're all very much looking forward to being on the other side of this crisis. Thanks again, Bob, for your time and for the Container Control Program for their collaboration in helping and supporting the UNODC Opioid Strategy to predict, prevent, and protect against synthetic drugs and synthetic opioids. And more so, I want to say a very heartfelt thank you to all the frontline officers that are working in your units in risking their lives on a daily basis to keep ours safe. So thank you again, Bob.
Thank you very much, Asma. It has been a pleasure talking to you.